morning, my name is Samira Wat Nieles. My teacher is John Moscoso. My topic is Pediatric Outcome after maternal cancer diagnosed during pregnancy. I'm studying nursing in Católica University. So, pediatric outcome after maternal cancer diagnosed during pregnancy. Fetal development is a complex process at different stages of development. Different aspects can be influenced by external factors. Among women, each one cancer is diagnosed during pregnancy. Factors such as maternal illness, diagnostic tests, cancer treatment, and increased levels of maternal stress can negatively influence fetal development. Cancer treatment during pregnancy exposes the fetus to potentially toxic substances that influence cell division. Chemotherapeutic drugs can cross the placenta in varying amounts. That is a video.
Because cancer is largely a disease of older adults, it is not common in pregnant women. Cancer affects approximately 1 in 1,000 pregnant women. The most common cancers found during pregnancy are the same as the most common cancers found in non-pregnant women during childbearing ages: breast cancer, cervical cancer, leukemia, lymphoma, melanoma, ovarian cancer, and colorectal cancer. Diagnosing a new cancer in a pregnant woman is difficult, in part because any symptoms are commonly assumed to be a normal discomfort associated with pregnancy. As a result, cancer is typically discovered at a somewhat later stage than average in many pregnant or recently pregnant women. Some imaging procedures, such as MRIs, magnetic resonance imaging, CT scans, ultrasounds, and mammograms with fetal shielding are considered safe during pregnancy. Some others, such as PET scans, are not. Treatment is generally large. Some treatments, especially certain chemotherapy drugs given during the first trimester, increase the risk of birth defects and pregnancy loss, spontaneous abortions, and stillbirths. Elective abortions are not required and, for the most common forms and stages of cancer, do not improve the likelihood of the mother surviving or being cured. In a few instances, such as advanced uterine cancer, the pregnancy cannot be continued, and in others, such as an acute leukemia discovered early in pregnancy, the pregnant woman may choose to have an abortion so that she can begin aggressive chemotherapy without worrying about birth defects. Some treatments may interfere with the mother's ability to give birth vaginally or to breastfeed. Also, when chemotherapy is being given after birth, many of the drugs pass through breast milk to the baby, which could harm the baby.
Okay. There is other video.
When cancer begins, it invariably produces no symptoms. Signs and symptoms only appear as the mass continues to grow or insides. The findings that result depend on the type and location of the cancer. Few symptoms are specific, with many of them also frequently occurring in individuals who have other conditions. Cancer is the new great imitator. Thus, it is not uncommon for people diagnosed with cancer to have been treated for other diseases, which were assumed to be causing their symptoms. Local effects. Local symptoms may occur due to the mass of a tumor or its ulceration. For example, mass effects from lung cancer can cause blockage of the bronchus resulting in cough or pneumonia. Esophageal cancer can cause narrowing of the esophagus, making it difficult or painful to swallow. And colorectal cancer may lead to narrowing or blockages in the bowel, resulting in changes in bowel habits. Masses in breasts or testicles may be easily felt. Ulceration can cause bleeding that, if it occurs in the lung, will lead to coughing up blood in the bowels to anemia or rectal bleeding, in the bladder to blood in the urine, and in the uterus to vaginal bleeding. Although localized pain may occur in advanced cancer, the initial swelling is usually painless. Some cancers can cause a buildup of fluid within the chest or abdomen. Systemic symptoms. General symptoms occur due to distant effects of the cancer that are not related to direct or metastatic spread. These may include unintentional weight loss, fever, being excessively tired, and changes to the skin. 25. Hodgkin disease, leukemias, and cancers of the liver or kidney can cause a persistent fever of unknown origin. Some cancers may cause specific groups of systemic symptoms termed paraneoplastic phenomena. Examples include the appearance of myasthenia gravis and thymoma and choroidal lung cancer. Metastasis. Cancer can spread from its original site by local spread, lymphatic spread to regional lymph nodes, or by blood homogeneous spread to distant sites, known as metastasis. When cancer spreads by a homogeneous route, it usually spreads all over the body. However, cancer seeds grow in certain selected site only, soil, as hypothesized in the soil and seed hypothesis of cancer metastasis. The symptoms of metastatic cancers depend on the location of the tumor and can include enlarged lymph nodes, which can be felt or sometimes seen under the skin and are typically hard, enlarged liver or enlarged spleen, which can be felt in the abdomen, pain or fracture of affected bones, and neurological symptoms.
Okay, let's see.
I grew up a member of the Church of Jesus Christ of Latter-day Saints. I graduated from high school in 1995 and I was VRU. I served a mission a few years later in the Tempe, Arizona mission. And then I came home from my mission and married my husband, Sean. We started our family and we have 5 boys now, and we've been married for 13 and a half years. One day we were coming home from Salt Lake and I found these 2 lumps in my neck. A couple of days later, the doctor showed up at my house and told me that I had Hodgkin's lymphoma, and he thought it was probably stage 2, but that I'd need to have more testing done. I had to go do tests every single day for like a week, and my kids were tired of their mom being gone all the time. We got on our knees and we just prayed to Heavenly Father that we would know that this answer would be very clear to us if this was right. And then the next day we went to church. I felt like I got my answer loud and clear, yes, you should use this for your cancer. And it was illegal in Utah. But there was a sweet lady whose husband had just died of cancer in Colorado who had called and offered me her apartment. We thought we'd just see how 6 weeks did. After those 6 weeks was over, I went home, had some tests done, and my cancer hadn't grown at all. I had to leave my 4 boys and my husband, and that was really hard to leave them, especially to just juice a leaf that doesn't have any effect on me. So Gabriel was born. He was 6 pounds and 6 ounces. And 18 inches long, and absolutely perfect. He was healthy, passed all his tests, and when we were able to bring him home, that's why I'm ready for this, because I don't want to be my kids again. I don't want to do chemo if I don't have to, and I feel like cannabis can be a huge blessing.
Utah, you can make a change this year. To find out how, visit dpputah.org. Discover new patient stories and the science behind cannabis with Illegally Healed. 2 words that don't belong together.
Okay. Growth and general health. The incidence of medical problems and the need of surgery or medical care were similar in the 2 study groups. However, one child in the prenatal exposed growth was excluded from further analysis because of the diagnosis of a syndromal enit. This case has been described in detail previously.
October of 2013, it was my second pregnancy, my second baby, and noticed lumps starting to form in my neck. And I went to the GP, and he put me on a waiting list and said that I'd be seen to in the new year. And lumps kept forming, and so it became obvious there was something wrong. And the obstetrician scheduled for me to go to some tests with the endocrinologist, and that's when I first heard the words, "We think it's cancer." I just couldn't believe it. I couldn't believe that I could be pregnant and have cancer. It just didn't seem possible. When I was first diagnosed, the doctor said that we are going to treat your case as a two-patient model because you are pregnant and there's no person involved. So they were there to give me the very best treatment, but to also protect my baby. So for instance, when I went for my CT scan, they had me covered up, my abdomen was covered by a huge sheet of blocking material so that my baby would be protected from radiation while I went through chemotherapy. Well, I was pregnant. Life isn't always easy. It can throw you a curveball and you're faced with seemingly impossible decisions. But, for me, the benefits outweighed the risks. And I am cured of cancer, and I had a healthy 17-month-old. Real healthcare saves lives. Abortion is not needed to treat cancer or any condition in pregnancy. My baby and I are living proof.
We finished the exposition. Thank you.